This is the NEU's fifth report on the state of COVID following the wider opening of schools on the 8th of March, recording this on Friday the 9th of April. And the overall coronavirus levels in the country have essentially plateaued. They declined sharply from January with the opening of schools and the other bits of opening up and the effect of vaccination. That has plateaued. When we look at the nations, though, there has been a bit of a decline in Scotland and quite a pleasing decline in Wales as well. So you do have to keep looking at this data, and we have to see what happens as vaccination spreads and as further widening happens. If we look at the regions in England, they are all fairly flat, but you can start to see an increase in the northwest, and there is possibly an increase in the southeast. The quality of the data, the uncertainties of the data do exist, so you can't be absolutely certain. When we specifically look at school ages, and these are reports from the Coronavirus Infection Survey done by the Office for National Statistics, so they're not based on children turning up for tests. This is a random sample. But on this level, you can see that on this graph, it looks like school age is falling slightly for primary age children. Although the margin for error of that is quite large, it might be flat, it might be slightly decreasing. Secondary looks like it's fairly flat. And I think it's important to say this is looking back on the week before last. Some schools were closed for Easter holidays, but not all of them. When we report on this next week or the week after, we'll probably see further declines as a result of the Easter school closure period. Then we have to see what happens during the summer. When you look at the comparison with all ages, you can see that the school ages have started to flatten off or come down. They are slightly above the all ages. We are starting to see in deeper data that cases are now quite low amongst all of those in our country who are aged 70 or more. And that's because they are so far through the vaccination process, first and second dose. And so the cases amongst 70-year-olds are now very low, and that's dragging down the average of the all age group. Lateral flow tests. Now, we do not support the use of lateral flow tests as an alternative to isolation, though there are some proper scientific studies going on to assess whether that is good enough in terms of the spread of COVID cases. But we don't support it until those studies have come in, at least. But we do really support the use of lateral flow tests for all asymptomatic people to try and pick up some of the cases, because then people can isolate and we can get cases down altogether. So this chart is a little concerning that we had such high use just above the 29th of March, and then it's declined in the last week during the Easter holiday closure period. I guess that's not that surprising that a lot of parents wouldn't have persisted with it with their children during the school holidays, but we do want to encourage them to go back to doing it when the holiday period's over. We think we need every mitigation we can in place. We're pleased that the government is continuing with mask wearing until the 17th of May at least. After the Easter holidays, we hope that ventilation gets easier, keep your windows open. We want to encourage parents to do lateral flow tests on children and for staff to do them as well. The news on hospitalisations and deaths on the next two slides continues to be very good. Hospitalisations are now down to where they were at the back end of September of last year, and that was really before the second wave had any effect on hospitalisations, so that's very good. Deaths coming down actually even sharper, and that's because deaths amongst COVID, the average age of death is in the high 80s, but the average age of hospitalisation is somewhere in the 70s. So the fact that vaccination has spread throughout means the 80-year-olds are all protected from death, and the hospitalisation protection hasn't got quite as far yet. But we expect those numbers for hospitalisations and deaths to carry on falling for a good while yet, and they'll only start going up if the government loses control of the pandemic and general cases start going up again. Attendance, we're not quite sure at the moment what this graph means. You can see the secondary line is quite a lot down on previous weeks. partly a third of schools are closed, but they aren't supposed to be counted on this. So we're not quite sure what that represents, because on this page, we say that only 2% of children were absent because of coronavirus last week. On the slide the slide that we reported on last week, that was 4%. So the number of children absent has gone down quite a lot. Last week we reported 9,000 confirmed cases. This week it's only 5,000. That might be partly because of less tests going on, and it might be reporting on an actual, there might be less COVID around. We have to keep looking and seeing from week to week what's happening on this, pressing on the mitigations, pressing for the government to be cautious, getting the vaccination rolled out. The information on clusters. Now, clusters is 2 or more cases in an institution, and this is all the clusters in education settings. And on this chart, the light blue line is special schools, and there were outbreaks, 2 or more cases in 4 special schools last week. That's 1 in 400 special schools. There were outbreaks in 22 primary schools. That's 1 in 800 primary schools, and in 13 secondary schools. That's 1 in 330 secondary schools. The total number of outbreaks at 39 was a lot lower than the weeks before. Partly, some schools were closed for the Easter holiday in this week, so it'll decline even more next week, but partly it might be that cases have fallen. This is a new chart for us. We're reporting on the prevalence of long COVID. So there is a sample that was a survey that was done on the 6th of March, and it asked people, did they have COVID symptoms on that day, and had they had them for more than 4 weeks, for more than 12 weeks. And on this chart, we've broken it down by all of the occupational categories. And the ONS used a very wide classification of people working in teaching and education, and that is more than schools. That is also early years settings and HE settings, higher education settings, and it's a lot more than just teachers. It's anybody working in those settings. And on this chart, what we see essentially is that education staff are in a sort of middle group. Those who can work from home are reporting less long COVID. Those who work in healthcare and social care are reporting more long COVID. And education staff are then in a group of others who can't work from home and about the same rate as them. And what this is telling us is that on the 6th of March, 2.5% of those who work in education were reporting that they had COVID symptoms and had had them for 4 weeks or longer. On this chart, this is about those on the 6th of March who said they had COVID symptoms and had had them for more than 12 weeks. So it's about 1.5% of education staff saying they'd had COVID symptoms for more than 12 weeks on the 6th of March. Now, both of these charts do not report on the severity of symptoms. The ONS does have some information on that, but it's not broken down by demographic groups, so not by occupational groups or by gender, etc. But and that's because this is, from their point of view, early science, that they don't have enough data yet. But of those who say they have, it's self-reported, these are not GP assessments, these are self-reported, of people who say they've got long COVID symptoms, the 4-week ones, for example, then what we're saying from this is, roughly speaking, let me just look, 38% of them said, I've got symptoms, but it's having no effect on my day-to-day life. Just over 40% said I've got symptoms and it's having a little effect on my day-to-day activities. And 18% of those who said they had long COVID said it was having a big impact on their everyday life. Like I said, the ONS doesn't have that broken down by occupational groups, but we think if that's true for teachers, then that, roughly speaking, means that a fifth of those with long COVID are saying it's got a significant impact. They're probably off school. If we multiply it, that would be about 2,500 teachers who would be off school with long COVID symptoms. We say that they should get full pay for the whole length of their long COVID illness, get in touch with our advice line if that's coming up as an issue for you. Reporting on vaccination, this continues to be good news. There was the restriction in supply compared with the fantastic week around the 15th of March when they got more in. Now, though, as well as carrying on doing, the blue line showing that there are still some first dose vaccinations going on, but the government is now having to catch, or the NHS is catching up with second doses, which is the brown line there. But there's still good news, and vaccination is still spreading. And certainly my position is I'm looking forward to my second dose of AstraZeneca in a few weeks' time. You can see on this that we've now, the NHS, the volunteers have vaccinated more than 60% of all adults in the country with a first dose, and the second dose has reached more than 10%. So we'll be reporting as we get more news about how the vaccination is going. The NEU is continuing to maintain school COVID map. At the moment, that is showing cases broadly stable, but look at your school, look at the area around your school. We're continuing to give advice on safety. There's good stuff on our website about how to do risk assessments, ventilation, mask wearing, etc. And we're continuing to talk about an education recovery plan. Thank you for being in the NEU, for listening to what we say about schools and safety. And if you haven't had an Easter break yet, I hope that you get some good rest for a week or so at least. Thanks very much, and speak to you next week.